Hello and welcome to Hornbill TV's News Pulse. I'm Akivito. In the previous week, 54 new COVID cases were reported from the state of Nagaland, and out of which 49 were detected in Dimapur, with 100% increase in weekly new cases. And as of Tuesday, Nagaland reported 29 fresh cases, and through which the total COVID tally in the state has risen to 32,331. In view of this increasing positivity rate spike in weekly cases, increasing positivity rate among self-tests and random tests, Dimapur has been put under situational level 2, which is under the yellow category. This was informed in the weekly bulletin of the state's Integrated Disease Surveillance Program, or IDSP. Strict adherence to SOPs like avoiding crowded places, wearing of mask and getting vaccinated is critical to prevent hospitalization. Nagaland has so far been able to administer 13,47,257 doses. And now to talk more on this yellow category and also the general ground reality of the COVID tally in Dimapur district, we have with us, joining us on this platform with Hornbill TV, the Deputy Chief Medical Officer of Dimapur, Dr. Antoli Su, who is on the line with us through the phone. So thank you, Doctor, for joining us on this platform.
Welcome. Yeah.
So, Doctor, on the 8th of Jan, the IDSP has declared that Dimapur, due to the increasing cases, the IDSP has declared that Dimapur is under situational level 2, which is also the yellow category. So, how grave is this situation for Dimapur, and also what are these categories all about?
Okay. Yeah. Good evening, Vito. Yeah, Dimapur has been placed under yellow category. So these are all situational levels, grading done from 0 to 4,
right.
Like where 0 is the green color, and then it progresses 1, 2, 3, and 4, where 0 is a minor threat, 4 is like an uncontrolled situation.
Okay.
So, actually, there are many indicators for this.
Right.
So, it's not only the positivity rate, etc.,
Okay.
but then we have like sample positivity rate, bed occupancy,
Yes.
or oxygen-supported beds, or growth rate of new cases, or active cases per 10,000 population. So these are many indicators,
Right.
which all bear equal weightage, and based on this, we give the categories.
Right.
So it's from mild to an uncontrolled situation. So right now, since our positivity rate is between 5 and 9, so we are in the yellow category.
All right.
At the moment.
All right, Doctor. So, Doctor, as of today's health bulletins from across the different states in Northeast, Assam has reported 9 Omicron cases, Meghalaya has 5, and Manipur has 1. And now there are a lot of experts and doctors commenting on this Omicron variant that due to its super spreader properties, one will not even realize that one has Omicron before even getting tested. So, with this in view, do you think that Nagaland already has an Omicron case, but it's yet to be detected?
That we cannot say that at the moment, because actually to detect this Omicron, or to say it's Omicron positive, we have to do the whole genome sequencing. Then only we can say whether it's Omicron or Delta or whatever it may be. So I think so far the state government has been sending samples for genome sequencing, but till today we have not got any Omicron positive there. So I think we cannot say that we have Omicron in the state officially.
Right.
Maybe since we are doing the tests for all the positives, so we're sending the samples for whole genome sequencing. So if it comes out Omicron positive, then we'll come to know about it then. Yeah.
All right, Doctor. Okay, Doctor, during the second wave of the coronavirus, I mean, Dimapur witnessed a quick surge in all the bed capacities in government-run COVID centers. And soon after the second wave started waning out a bit, then the government took out a slew of projects to beef up the availability of medical facilities. So this time around, what has the state government and also the department done to actually boost its medical facilities?
Yeah. So right now we can say that our state government, or even our Dimapur district, were fully prepared as far as beds and oxygen and all these things are concerned. As you have rightly mentioned, after the second wave, the government has taken up so many measures. So we have the new hospital there in Sachesar, as well as the 50 bedded in district hospital. All this has been made functional now. So Then we have the oxygen plants also, which are all, working well. And I think we have enough oxygen supply or ICU beds. Everything has been kept ready at the moment.
All right, doctor. When it comes to the third wave, do you think Dimapur is prepared when it comes to medical facilities and also oxygen and also bed availability? And what would be the most cost-effective way to treat oneself?
Yeah, as I've mentioned before, as of today, we have prepared ourselves. We never know what will come, but then what we know and what we can, as far as beds are concerned, or oxygen is concerned, or the ventilators are concerned,
True.
we have made adequate preparation.
All right, doctor.
So I think it should be okay for us. And then the best will be, if we, the public, can follow the COVID appropriate behaviors.
All right, doctor.
I think that will be the best for all of us. Because this is a super spreader. I mean,
Yes.
this transmissibility of this Omicron is very high.
Yes.
So we are all hoping that, we all kind of take care of our own selves
All right, doctor.
and prevent as much as possible. That will be the best mechanism. Yeah.
All right, doctor. So coming to a new term, doctor, we've been hearing a lot in the media about this new treatment, or rather therapy, called the antibody cocktail therapy. So what is this therapy all about, and is it available in Dimapur? And because like just a few weeks back, we heard about this anti-cocktail therapy when Saurav Ganguly, who's the BCCI chairman, he was treated with antibody cocktail. So what is this therapy all about?
This COVID antibody cocktail, it's a combination of man-made antibodies,
All right.
and that inhibits the coronavirus from infecting the new cells.
Okay.
So this is also a new form of therapy, and we have this available with our state government.
All right.
So we have not yet tried it out,
Okay.
but I think in other places, in other districts, in other states, they're trying it out. So let's see how that will be. But then it is also available in Nagaland.
All right, doctor. Doctor, when it comes to antibody cocktails, the latest we've heard is they are pretty expensive. The antibody cocktails can go to the price of 1,20,000. So is there any mechanism that is being procured by the government to actually give this kind of a treatment to those who are economically very poor, or rather who come from a economically very weaker section?
Since our state government has procured some of them,
All right.
and it is available with the state government, so hopefully it will be given to the public. That I think details will be worked out very soon. I cannot say exactly how that will be,
All right,
but what we know is that it is available with the government, so if needed, then it can be used.
All right. Doctor, before we end our conversation, this would be my last question, and that would be, doctor, in your perception, how happy are you with the vaccination drives that are going on across Nagaland?
I think for the whole of state of Nagaland, I cannot say, but at least in Dimapur, it is going on very well.
All right,
People are coming forward to take the vaccination, and we have started the vaccination drive in all our health units, in all the vaccination centers,
All right,
and we're even going, to the schools
All right, doctor.
to vaccinate the students. And I think so far the response has been very positive, so we're very happy about it. Yeah.
All right, doctor. Thank you so much for joining with us on Hornbill TV, and we hope that you all are safe and you guys can also keep all the civilians in Dimapur district safe. And thank you for the good work that you are doing every day. Thank you, doctor.
Okay, welcome. Yeah, thank you.
So that was the Deputy Chief Medical Officer of Dimapur, and she has just explained to us that Dimapur, in regards to Dimapur, Dimapur is ready for any kind of third wave, and they've got enough medical supplies, and they've got enough medical facilities, they've got enough beds, they've got enough ventilators to take care of the public of Dimapur district. And the doctor also importantly mentioned that if the public themselves follow the COVID appropriate behavior, then this would be the best way to prevent oneself from staying safe and also from not getting infected with coronavirus, or rather the new variant, which is actually brewing a storm in the whole of the country of India.